The notion of safe abortion undermines the consensus reached at the Interconference on Population Development that abortion is a political matter and not a human rights issue. Paragraph 8.25 of the conference outcome recognized that each country should decide its abortion laws at the national level without external interference, and the country should help women avoid abortion and provide mothers and their children with health care and social support. Including abortion as a human right undermines this consensus and creates the danger that women will be pressured to abort their babies.
The deliberate and persistent mischaracterization of consensual language by certain delegations to promulgate contentious terminologies must stop.
La imposición de este concepto de aborto en los documentos de Naciones Unidas viola la Carta de las Naciones Unidas, sus propósitos y principios, sobre todo la no injerencia en los asuntos internos de cada país. Reiteramos, tal como se estableció en la Conferencia Internacional sobre la Población y el Desarrollo, es un derecho soberano de cada país decidir sobre la legislación interna que regula esta materia. Nicaragua reafirma su posición de principio de acuerdo con nuestra Constitución y leyes, la cual establece que toda persona tiene derecho a la vida, siendo este un derecho fundamental e inalienable desde el momento de su concepción.
Ma délégation tient aussi à souligner que dans sa compréhension, le terme genre renvoie uniquement aux rapports sociaux entre le sexe masculin et le sexe féminin, aux rapports sociaux entre hommes et femmes. À cet égard, la notion d'avortement sécurisé en tant que droit humain, notamment à l'OPCI, n'est pas internationalement reconnue. Ainsi, toute mention de l'avortement, je le rappelle, stipule que l'avortement ne peut être promu en tant que méthode de planification, que les gouvernements doivent aider les femmes à éviter l'avortement et que les agences internationales ne doivent pas interférer dans les politiques nationales d'avortement car elles relèvent de la compétence exclusive des États souverains.
6. Por contener referencias a derechos sexuales y reproductivos, así como al aborto en condiciones de seguridad cuando esos servicios estén permitidos por la legislación nacional, lo que se puede interpretar como prácticas abortivas mismos que contravienen nuestra legislación nacional.
Third, OP6 promotes the notion that access to safe abortion is part of the promotion of human rights. We note that the term safe abortion is not internationally agreed. Therefore, the adoption of this resolution cannot be interpreted as creating a new right or creating a new international legally binding obligations. My delegation hence dissociates from OP6.
The resolution, including safe abortion, sexual and reproductive rights, intimate partner violence, and gender-based violence. And we disassociate ourselves.
We believe that it contains important aspects which do not belong in the text and would be better addressed by domestic constituencies. In particular, Brazil does not support references to reproductive rights or abortion in the draft and has called for their deletion from the text. The Brazilian government would like to clarify, therefore, that the resolution should not be interpreted in any way as condoning or supporting abortion as a method of family planning. In Brazil, abortion is illegal except in specific cases prescribed by law or high court decision, such as pregnancy resulting from rape. While recognizing the merit of international cooperation to fight sexual violence, we believe it is important to maintain national prerogatives to define the appropriate policies on sexual and reproductive health according to domestic law and practices. Thank you.
This is incorrect as a matter of international human rights law. Abortion is not an agreed international human rights law. We should not be creating new rights in international law. My country, Nigeria, abortion is illegal, except we are permitted by medical personnel. UN member states agreed that abortion is a subject to be dealt with exclusively in national legislation. In paragraph 8.25 of the ICPD Program of Action, we emphasize that the Program of Action of the ICPD also called on member states and the UN system to help mothers and avoid abortion by providing them with alternatives, especially maternal health and social support. Language about access to sexual and reproductive health care services and sexual and reproductive health and reproductive rights in primary paragraph 17 and 18, as well as operating paragraphs 2b and OP6 is routinely misinterpreted by donors and implementing partners, including within the UN system. When UN agencies and the Secretariat promote abortion, compulsory education, homosexuality, and other controversial social policies, they are acting ultra-vires and
includes divisive and contentious terminologies that are inconsistent with the positions of many countries, including Malaysia. These concerns are not new and were repeatedly stressed throughout the negotiations, clearly to no avail. While we want to wholeheartedly support a resolution on providing victims and survivors of sexual violence with proper access to justice, remedies, and assistance, the incorporation of problematic terminologies in the text by choice prevents my delegation from doing so.